Hi everyone, my name is Dr. Yoni Arthur and I'm an audiologist and strength coach. Thank you so much for joining me on my channel, The Steady Coach, where we talk about all topics related to vertigo, dizziness, balance problems, health, and wellness. One question I've been asked a lot recently is why people are still suffering from dizziness, vertigo, and other balance-related symptoms after recovering from COVID-19. Obviously, this question is coming up a lot more as more and more people are exposed to the virus. So today we're going to talk about why you might still be suffering from dizziness after recovering from COVID-19 and some of the things that you can do about it. Most of you are probably already aware that COVID-19, or the coronavirus, is primarily a respiratory disease, so it's something that causes issues with your breathing system. But as time has gone on, it's become more obvious that COVID-19 causes additional problems in the body, and these are the ones we're going to focus on when we are trying to explain why people might have persistent dizziness or balance problems after recovering. Most importantly for our discussion, COVID-19 causes issues with blood supply and clotting. It causes issue with the immune system, and it can cause direct death of certain types of cells. Long before COVID-19 was ever around, we already knew that viruses could cause dizziness, vertigo, and balance problems. And there were four main mechanisms. So there are four main ways that a virus can do this. The first is that it could potentially affect the blood supply to the tiny little structures in the inner ear. The inner ear's little structures include the balance organ, or your semicircular canals and otoliths, and these organs have very, very, very tiny little blood supply tubes that go to them. So any microclotting, any tiny little clots or interruptions in blood supply to those organs could potentially cause damage to them, permanent damage, temporary damage, or even the death of the entire system. Our inner ear works through tiny sensory hairs or tiny sensory cells that have to be supplied with constant oxygen-rich blood in order to work well. And when they don't receive that oxygen-rich blood, they can die off, and they don't return even if the entire system recovers. The second way a virus can affect the inner ear is it could cause issues with the immune system. In certain situations, it's not so much the virus that causes people to have bad effects, it's that the body's immune system, so your own defense system, starts to attack certain tissues in your body. And in some cases, it appears that your own immune system may attack the cells in your inner ear and cause damage or death to those cells. There are also potential direct effects from the virus. So you may have heard in the news that this particular virus, COVID-19, looks for cells with a certain type of receptor or keyhole or protein on the cell, and that's how it attaches to the cell. So those types of cells are found plentifully in the inner ear. The virus could then directly attack the inner ear and cause damage or destruction. And finally, many people who have viral illnesses develop secondary infections. So they develop some other infection, say a bacterial pneumonia or some other type of infection that takes advantage of the immune system's weakened state as it's trying to fight something else off. And sometimes those people have to have life-saving treatment administered to them in the form of antibiotics. Some antibiotics, very strong antibiotics that are used in the hospital for situations like this, for life-saving situations, can also cause ototoxicity or damage again to the inner ear. So in all four of these scenarios, the inner ear is damaged, and in many cases, it may be damaged beyond recovery. Most of the time, the damage occurs more on one side or almost entirely on one side, with the exception of the fourth possibility, which is when someone is given antibiotics that cause damage to the inner ear. So let's shift gears here and talk a little bit about how we balance. So you have two organs of balance, one in your left ear and one in your right ear, and those two organs both send information to the brain. The brain then gets complementary information from both ears, so it's looking for a match between the information it gets from both ears. Most of the time, if you move one way, one ear tells you, we've moved this way, and the other ear tells you, we've moved this way. And then the brain says, okay, clearly we moved this way, and it responds appropriately. In cases like what we were just talking about, where a virus may have impacted just one ear especially, you're getting conflicting information from both ears. So one ear's saying, we're moving this way, and the other ear is giving you just static, bad information because it's damaged. The brain doesn't know what to think, and therefore it's going to perceive movement. It's going to perceive that you're moving even when you're not actually moving. That is vertigo. That is the sensation of vertigo. Now here's a fun fact. The balance system, so the vestibular system, that's the little inner ear organs that affect your balance or that sense balance, those are the first sensory system to be completed in fetal development. AKA, your body is much more concerned about your ability to balance and know where you are in space than any other sense. So it's really no wonder that when you have vertigo attacks or dizziness, it can feel so completely awful and so completely disorienting. Your body places really high priority on those senses. Important note here, as I was saying before, usually one ear is damaged worse than the other in most cases. And in some cases, that's not true. You'll have equal damage to both ears. In those cases, most of the time, people won't experience that spinning vertigo because the brain is actually still getting equal information from both ears. It's just not getting very high quality information. So people who have damage to both ears, instead of experiencing the spins or true dizziness, they'll find that they're just unsteady and off balance. So what should you do? If you're here and watching this video, you're probably still experiencing dizziness and vertigo or other balance-related symptoms after your COVID-19 recovery. In most cases in my videos, I give you some applicable tools, some exercise tools that you can use right away to help yourself feel better. But in this case, I cannot more strongly emphasize that you need a good diagnosis so that your therapists and physicians will know what to do for you. There's a really big difference between the ways that we treat issues with the inner ear to issues with the nervous system to issues involving both ears, and you really need a good diagnosis to get those treatments. So see an ear, nose, and throat physician and or a neurologist to make sure you get a good medical diagnosis first, if there is one. While you're doing that, you want to see an audiologist for a comprehensive vestibular evaluation. So doctors of audiology are the individuals who are trained to take a look at your inner ear, the organ of that inner ear that may be damaged from this viral attack, and tell you if there is in fact damage to that organ. There are many different tests that an audiologist might use, and we can go into that in a later video. But you should be looking for an audiologist who will use one of the following tests or more of the following tests. You should be looking for someone who can do video nystagmography or VNG, which is a test involving placing goggles on your head and having you do a few different things to see how your inner ear is doing. You should be looking for an audiologist perhaps who has access to rotational chair testing, rotary chair. And that is another test involving putting goggles on and having the chair move you to see how your ears and eyes and brain respond to movement. And another test that is really valuable in some cases is video head impulse testing, or VHIT, which is a test also involving wearing goggles, having your head moved in very quick ways to see, again, how your balance system responds to very quick movements. All of these tests will allow your audiologists and physicians to put together a good picture of what has actually happened, and that is the only way that we can proceed to good treatment. The best piece of advice that I have for you is to not Google your symptoms. And I know that's really hard, but remember, the nervous system and the vestibular system are very closely linked. And we've talked about this in previous videos. If you want to learn more about that, you can look at my video on PPPD, and I will link that above. Now, because the nervous system has such an effect on how your brain will react to any issues with your inner ear, you really want to avoid getting yourself into situations that are going to provoke unnecessary anxiety. And that is exactly what Google and WebMD and all of those other very well-meaning websites will do if you are looking up your symptoms. You're going to run into people who've had terrible experiences. Again, why are they online? They're online because they've had terrible experiences and they're not out being able to live their lives. So you're going to get a very biased view of what your outcomes may be if you go online and try to read other people's experiences. So while we're still in this investigational stage, let's do the investigation properly, get you to see a vestibular rehabilitation therapist to help you mitigate your symptoms or feel better. And then in that process, you can start reaching out to other people for support, trying to find other people who are positive like you, who want to get better like you, who may be able to offer you advice, but aren't going to just fearmonger and make your nervous system do the fight or flight thing, get really, really agitated, which again is going to aggravate and make worse your symptoms. So I have a little bit of advice for you in the meantime. If you're experiencing really severe symptoms of nausea, vertigo, and dizziness, then talk to your physician for medical options just to keep you comfortable until we get some answers for you. If you're not having really severe symptoms, or they're episodic, meaning they come and go, or they're intermittent, they come and go, here are some pieces of advice for you. Your balance system doesn't just rely on your inner ear, it also relies on your sense of touch and your sense of vision. So in the meantime, if you feel like your balance is a little bit off, you can try walking barefoot or wearing very thin shoes so that your body has a little more information about your environment than it would if you're wearing your normal or very thick shoes or heels. You can also make sure that you have really good lighting. So if you have to get up and go to the restroom in the middle of the night when it's dark, make sure that you have good night lights around so you can use your sense of vision to help you balance in the meantime. Make sure you take deep, grounding breaths. And if you enjoy, you can also do other relaxing things like meditation and yoga. But if that's not your jam, just a few 5 to 10 deep grounding breaths when you're experiencing anxiety or the start of symptoms will help train your nervous system to react a little less strongly to whatever nonsense is going on in your inner ear. Remember, you will get better. There is hope for you. There is treatment for you. We just have to get some answers first. If you're capable, get outside and go on some walks. There's nothing like a little bit of sunshine to help recalibrate your nervous system. And it's actual science. I'm not just telling you to go out for a walk because there's nothing else we can do for you. The science shows that being outside, getting sunshine, especially earlier in the day or when the sun is high, will help relax your nervous system and get your sleep regulated, get your sleep on track. All of those things really matter right now, especially while we're still waiting to figure out what exactly went wrong. Now, what if you've already seen the physicians? You've already gotten the diagnoses and you still feel terrible. Well, you can also look at my video on PPPD, which is a disorder that's closely related to what you may be going through. That video explains why this happens, how your nervous system is involved in that, and some steps that you can take to help calm the nervous system down and stop feeling your symptoms as often as you do. That video even has a beginner's exercise program to get you started, give you some confidence to get up and start moving again. Thank you guys so much for tuning into my video today. I know this probably brought up a lot of questions for you, and there are many people out there suffering from some of the symptoms that you may be suffering from. Drop a comment below and I'll be happy to answer your questions and maybe even do a future video on the topic that you're interested in hearing more about. Again, guys, please subscribe and share if this video was helpful for you, and I look forward to seeing you next time. Thank you.